So a number of studies have looked at hypomethylating agents plus venetoclax in post-MPN AML. All of the data seems to indicate roughly a response rate in the mid 40% range, which is perhaps a little bit higher than we've seen with some other combinations. But overall, the patients are living about median of 6 months, which isn't so different from using hypomethylating agents alone or using hypomethylating agents plus ruxolitinib. Part of the reason for that is there seems to be some degree of increased toxicity. We see more bleeding events and more infectious events with venetoclax and hypomethylating agents in this patient population. I think there is possibly the opportunity to think about optimizing the dosing, given that these patients are more sick than many de novo AML patients, but how we do that remains to be determined.